Imagine this. Your loyal, furry companion, usually the picture of boundless energy, starts to slow down. Maybe they're gaining a little weight without a change in diet, or you're noticing strange patches of fur loss. It's easy to think, oh, they're just getting older. Oh, it's a common assumption. But what if these subtle changes are actually signals of a treatable condition? One that, if left unaddressed, could significantly impact their health and happiness. Welcome to a deep dive into canine hypothyroidism, a really prevalent endocrine disorder that affects many of our beloved dogs. Today, we're pulling insights from a comprehensive article by Dr. Tsuche, focusing on the diagnosis and treatment of this condition. Our mission is to cut through the medical jargon, giving you a clear, actionable understanding of what hypothyroidism is, how to spot it, how vets confirm it, and most importantly, how it's treated to ensure your dog lives a long, healthy life they deserve. Whether you're a seasoned dog owner, thinking about bringing a pup home, or just curious about animal health, this deep dive will arm you with some crucial knowledge. Okay, let's unpack this then. At its core, canine hypothyroidism is an endocrine disease where a dog's thyroid gland just isn't pulling its weight. Specifically, it doesn't produce enough of two critical hormones, T4 and T3.
Right. And when these levels drop, it effectively puts a brake on their entire metabolism. It just slows everything down. It's a surprisingly common condition. And what often catches owners off guard is the age range it impacts. While we typically see it in middle-aged dogs, maybe between 4 and 7 years old, it can certainly show up much earlier, even as young as 2 or 3.
Really? 2 or 3?
Yeah, and this early onset is a key point because vets might initially misdiagnose it, maybe thinking it's just an old dog's disease, when in reality, a younger dog could be suffering unnecessarily. Also, something we often see is a higher risk in spayed pets, though interestingly, there isn't a known sex predisposition across the board.
Okay, so if the thyroid isn't producing enough hormones, what's actually causing that breakdown? It sounds like there's more than one potential culprit.
You're right. It's not a simple one-size-fits-all situation, which, adds to the diagnostic complexity. In the vast majority of cases, we're talking about 95%. We're looking at what's called primary hypothyroidism.
Primary.
Which just means the problem originates directly within the thyroid gland itself.
And within that primary category, what's the most common reason for the thyroid to, fail?
So the leading cause is something called lymphocytic thyroiditis. This is basically an autoimmune reaction. For some unknown reason, the dog's own immune system, specifically its lymphocytes, mistakenly attacks and destroys its own thyroid tissue. When this happens, the body tries to compensate, so you'll often see a rise in thyroid-stimulating hormone, or TSH, as the pituitary gland tries to sort of kickstart the failing thyroid.
Right, trying to make it work harder.
Exactly. Another common cause in this primary group is idiopathic atrophy.
Yeah.
Here, the normal thyroid tissue is simply replaced by fat and connective tissue, but without that obvious inflammatory autoimmune attack. Some researchers actually believe this might just be the end stage of lymphocytic thyroiditis, though.
Interesting.
And though much rarer, tumors can also be a cause, growths on the thyroid.
Okay, so that's mostly problems in the thyroid. But can issues elsewhere in the body lead to hypothyroidism?
Absolutely. That's what we call secondary hypothyroidism, and it accounts for a much smaller percentage of cases. Here, the thyroid gland itself might be fine, but it's not getting the proper signal.
Like a communication breakdown.
Precisely. This happens when there's a reduction in the production or activity of TSH, often due to issues like pituitary gland tumors or malformations. Certain medications or other diseases can also suppress TSH. And then much more rarely, there's congenital hypothyroidism, where a dog is born with the condition.
Oh, wow.
Yeah, this can be due to an underdeveloped thyroid, maybe a deficiency in iodine during fetal development. Iodine is crucial for thyroid hormone production.
Right.
Or even exposure to goitrogenic substances. Those are things that interfere with the thyroid's ability to actually produce those essential hormones.
So it's clear there's a range of causes, some more common than others, but it's not entirely random, right? You mentioned some dogs are simply more predisposed.
Exactly. And this really raises an important point for owners. If you have one of these breeds, heightened vigilance for subtle symptoms becomes even more critical. Our sources highlight quite a few breeds, things like golden retrievers, Doberman pinschers, dachshunds, Irish setters, schnauzers, miniature poodles, cocker spaniels, chow chows, and English bulldogs.
That's a lot of popular breeds already.
It is, and the list keeps going. You've got Great Danes, Newfoundlands, Airedale Terriers, Irish Wolfhounds, Scottish Deerhounds, and Afghan Hounds. Some breeds are even considered at an exceptionally high risk, such as standard Doberman pinschers, Tibetan Mastiffs, Boxers, Alaskan Malamutes,
Wow.
English Setters, Beagles, American Cocker Spaniels, Old English Sheepdogs, Rhodesian Ridgebacks, Giant Schnauzers, Siberian Huskies, and Havawarts.
So if your dog is on this list, or even a mixed breed with these genetics, knowing what to look for can make all the difference.
Absolutely. Early detection is key.
So what does this all mean if you're looking at your own dog right now? What are the actual symptoms we should be keeping an eye out for? Since thyroid hormones touch so many bodily functions, I imagine the signs are incredibly varied.
They really are, and this is where it gets tricky for owners. The single biggest takeaway for symptoms. They often mimic simply getting older.
Right.
Many of these signs can be easily mistaken for natural aging or other common ailments, which makes early detection a real challenge. For instance, you might notice lethargy and a general lack of vigor. Your dog just seems to be slowing down or acting older than they are.
Right.
There's often unexplained weight gain, even if their appetite hasn't increased at all. And they might show exercise intolerance, getting tired much faster than before, on walks or during playtime.
And I've heard they can become sensitive to the cold. Is that true?
Yes, cold intolerance is another key sign. Your dog might start seeking out unusually warm spots, like persistently lying in sunlight or cuddling up right next to heaters. They can also exhibit mental dullness or behavioral sluggishness, seeming less playful or engaged than usual, just sort of flat.
And the skin and hair problems are often quite distinctive, aren't they? That seems to be a big one.
They are, and they're very common. Owners often observe bilateral symmetrical hair loss, especially on the trunk, hind legs, and tail. Sometimes it gives the tail that thin rat tail appearance.
The rat tail.
Yeah. Their fur might become dry, brittle, or dull with excessive shedding. You might also see skin hyperpigmentation, where the skin darkens, or it might thicken up. Seborrhea is another common issue. That's the oily, flaky skin that often comes with a distinct, sometimes kind of foul odor.
Ugh. Okay. And it impacts healing, too.
It does. These dogs can have poor wound healing and very slow hair regrowth after shaving. Vets often notice this after a surgical procedure or even just clipping for a blood draw. Plus, they're at an increased risk of developing recurrent skin and ear infections, which can be a really frustrating cycle if the underlying hypothyroidism isn't treated.
Yeah, I can imagine.
Other notable signs can include a tragic facial expression. It sounds odd, but it's due to thickened facial skin. And ocular issues like corneal lipid deposits, which are basically fat deposits in the eye, and dry eye can also occur. In more advanced cases, you can even see neurological symptoms like issues with facial nerves that might affect blinking or swallowing, or even a slow heart rate and, as we touched on, that high cholesterol.
Okay, wow. Given how many of these symptoms can easily be mistaken for other issues or just old age, I'm sure many listeners are wondering, how on earth do vets accurately diagnose this? It must be a pretty precise process.
It absolutely is, and this is where a holistic approach is critical. There's no single gold standard test, which means vets need to combine clinical observations with multiple test results to avoid misdiagnosis. The journey usually starts with a thorough veterinary examination and getting a really detailed history from you, the owner. Your vet will be assessing all those clinical signs we just talked about.
And from there, they'll move to blood work, I assume?
Yes, often starting with routine blood work and a urinalysis. This includes a complete blood count, or CBC. It's a common test that gives a picture of their overall blood health. About a quarter of hypothyroid dogs show a mild non-regenerative anemia, meaning their body isn't producing new red blood cells as effectively as it should.
Yep.
The biochemistry profile is also key. Approximately 3/4 of cases, 75%, will show fasting hypercholesterolemia, that's high cholesterol, and about a third might have mildly low sodium levels.
So the core thyroid hormone tests are next then. And I've heard total T4 is often the first step.
That's right. Many vets start with total thyroxine T4 levels for initial screening. But here's a crucial warning, really important. A low total T4 alone is not enough to definitively diagnose hypothyroidism.
Right. You mentioned other things can affect it.
Exactly. These levels can be affected by so many things. Your dog's age, their breed, certain medications, or even other systemic illnesses they might have. Stopping the diagnosis at just a low total T4 can be very misleading and could lead to unnecessary lifelong medication.
Okay, so that's a really important caution. If total T4 isn't the whole story, what gives a more reliable picture?
That would be free thyroxine FT4 levels. Think of total T4 as the total amount of the hormone in the blood, but FT4 is like the unbound active portion, the part that's actually doing the work in the body. That's why it gives us a much clearer, more reliable picture. It has over 97% specificity for canine hypothyroidism and is generally less affected by common drugs or other diseases, though I should say it can still drop in very severe illness. So basically, a low FT4 level, especially when your dog isn't severely sick from something else, strongly indicates true hypothyroidism.
Got it. And then there's thyroid stimulating hormone, or TSH levels. We mentioned it earlier, stimulating the thyroid. But how does it fit into the diagnosis?
Right, TSH. It's the signal from the pituitary gland telling the thyroid to produce T3 and T4. So in true hypothyroidism, where the thyroid isn't working properly, you'd expect the TSH levels to typically rise as the body tries harder and harder to stimulate it.
Makes sense.
However, it's not a perfect test either. It has limitations. Up to 30% of genuinely hypothyroid dogs can actually have TSH levels within the normal range. And conversely, sometimes healthy dogs with other non-thyroid illnesses can have elevated TSH for other reasons. This is why combining both FT4 and TSH tests is really considered the most reliable approach. A combination of low FT4 and high TSH levels makes a diagnosis of hypothyroidism highly likely. It dramatically reduces the risk of overdiagnosis.
That makes perfect sense. It's about seeing the full puzzle, putting those pieces together. Our source also mentions a thyroglobulin autoantibody test. What's that one for?
Yeah, that test can be incredibly useful. It helps diagnose that autoimmune thyroiditis we talked about before full-blown hypothyroidism even develops.
So it's like an early warning sign?
Kind of, yes. It can identify dogs at risk, which is valuable for screening in susceptible breeds and even for making informed breeding decisions, to try and reduce it in future generations. Now, when it comes to diagnostic challenges, we absolutely need to talk about euthyroid 6 syndrome.
Okay, what's that?
Basically, many non-thyroid diseases and certain medications, things like steroids, glucocorticoids, phenobarbital for seizures, certain antibiotics like sulfa drugs, even aspirin can unfortunately alter thyroid hormone test results. They can make it look like hypothyroidism when it's actually not.
Oh, so that complicates things further.
It really does. Your vet will often need to address any other underlying illness first, or maybe temporarily discontinue certain medications before retesting the thyroid levels to get a clearer picture. It really underscores why there's no single gold standard test. Vets absolutely must integrate their clinical judgment with multiple test results. And sometimes these tests, like FT4 and TSH, require specialized labs, which can mean higher costs and longer wait times too.
Right, that's practical stuff to keep in mind. So once a dog is definitively diagnosed, what's the path forward? The good news is, it sounds highly manageable, right?
Absolutely. This is where it's important for owners to understand it's a lifelong commitment, but it's one that drastically improves a dog's quality of life and prevents some really serious health complications down the road. The main treatment is lifelong hormone replacement therapy using synthetic levothyroxine. It's basically giving back the hormone the thyroid isn't making enough of.
Okay. And what does that look like for an owner day to day? How is it administered?
Typically, it starts at a dosage of about 0.02 milligrams per kilogram of body weight, given as a pill, usually twice daily, roughly every 12 hours. For larger dogs, the twice daily dose usually won't exceed 0.8 milligrams per kilogram. But the key here is that the dosage is highly customized. It's based on your dog's weight, how they respond clinically, are their symptoms improving, and most importantly, their blood thyroid hormone levels.
So monitoring is a big part of it then. It's not just one prescription and done. What does that ongoing commitment look like for an owner?
Monitoring is absolutely crucial. Non-negotiable, really. T4 levels are usually measured about 3 to 4 weeks after starting treatment. And it's important that blood serum T4 levels are measured 4 to 8 hours after the morning medication is given to get the most accurate reading of peak levels.
Okay, timing matters.
It does. If T4 levels are still low, or kind of at the low end of the normal range, the levothyroxine dose might need to be increased, with T4 rechecked in another 3 to 4 weeks. If the levels are looking good, maybe at the high end of normal or slightly above, they'll usually maintain that same dose. Once a stable maintenance dose is established, T4 levels are rechecked after 3 months and then typically every 6 months for long-term maintenance. Regular checkups and dosage adjustments are just essential to prevent both over or underdosing.
Right. What happens if a dog accidentally gets too much medication? Are there risks?
Yes, that's a serious concern. Too much medication can actually flip them the other way and lead to hyperthyroidism, the opposite condition. This can manifest as hyperactivity, maybe insomnia, weight loss despite a good appetite, excessive panting, nervousness, and drinking a lot more water. The good news is that with appropriate dosing and that regular monitoring we stressed, side effects are usually minimal. Beyond the hormone therapy itself, your vet will also address any secondary issues, like those skin or ear infections caused by the hypothyroidism, and often recommend dietary adjustments or other lifestyle support too.
Okay, that's really helpful. It's such a relief to hear it's manageable. But what's the timeline for improvement? How quickly will an owner actually see changes in their dog once treatment starts?
You know, the rapid response to treatment is actually one of the most rewarding aspects for both veterinarians and owners. It's often quite dramatic. Most owners typically notice clinical improvement in their dog's energy levels, their behavior, and even general skin condition within the first few weeks, usually around 3 to 4 weeks after starting treatment.
That's pretty fast. That must be encouraging.
It really is. Most of the general symptoms like lethargy and weight gain usually resolve within 4 to 8 weeks. However, those common skin conditions we talked about, like the hair loss and dull fur, they often take longer, maybe several months to fully resolve. But they are usually well controlled with proper T4 regulation, and complete hair regrowth can take maybe 2 to 3 months, sometimes a bit longer.
Patience is needed for the coat then. So what's the overall prognosis for a dog with hypothyroidism once they're on treatment? What can owners expect long term?
The prognosis for most dogs with hypothyroidism is excellent, truly excellent, provided they receive appropriate lifelong treatment. It's an incurable disease. Yes, we can't fix the thyroid itself, but it is very effectively managed. It allows pets to live normal, healthy lives for many, many years.
That's great news.
Yeah. There are rare exceptions. Like myxedema coma, that's a severe, life-threatening form of advanced, untreated hypothyroidism or maybe undiagnosed congenital hypothyroidism in puppies. Those have more guarded prognosis. But it's critical to understand that untreated hypothyroidism has severe consequences. It negatively impacts nearly all organ systems, leading to that high cholesterol, decreased immune function, a slowed heart rate, neuromuscular problems, and just overall poor health and quality of life.
Right.
That's why consistent treatment and regular monitoring are absolutely essential to maintain their health and prevent complications from either over or underdosing. It ensures a good long-term quality of life.
That's such an encouraging outlook overall. Now, this is interesting. Beyond the prescribed medication, one of our sources delves into the idea of auxiliary supplements that might offer additional support for dogs with hypothyroidism. But a crucial reminder here, and we can't stress this enough, always discuss any supplements with your veterinarian before adding them to your dog's regimen. They know your dog's specific situation.
Absolutely. That disclaimer is key. The idea behind these supplements, as presented in this source, is sort of a multifaceted approach, aiming to both potentially reduce autoimmune damage to the thyroid, if that's the cause, and provide essential nutrients for hormone production. For instance, probiotics, specifically Lactobacillus acidophilus, are suggested. The thinking is they may help by reducing gut inflammation, which could potentially lessen additional damage to the thyroid.
Interesting.
Yeah. The suggested dose mentioned is at least 100 million CFU, that's colony-forming units, the measure of beneficial bacteria per 10 pounds of body weight daily.
Okay. Interesting, connecting gut health to thyroid health. And what about vital minerals? Are there any mentioned?
Absolutely. Zinc is highlighted as a mineral vital for thyroid hormone production. The source suggests a dose of approximately 25 milligrams per 50 pounds of body weight daily. Similarly, selenium is another crucial trace nutrient needed for thyroid hormone production. The recommendation there is about 1 to 2 micrograms per pound of body weight daily. Again, check with your vet. These are just suggestions from the source.
Right, always check. And we know iodine is so important for thyroid hormones. How might that be supplemented, according to this source?
Our source suggests iodine from seaweed, specifically nori, the kind used for sushi rolls. It's presented as a potentially safe and natural way to supplement this key trace nutrient.
Nori, okay.
Yeah, and seaweed also offers other benefits, apparently rich in iron, magnesium, B12, and omega-3 fatty acids. The suggested dose mentioned is 1 sheet of nori per 50 pounds of dog daily. Lastly, ashwagandha, which is also known as Indian ginseng, as mentioned. This is an adaptogen herb.
Ah, adaptogen.
Yeah, the idea is it can help glands like the thyroid respond better, potentially increasing hormone production if it's insufficient. The suggested dose for ashwagandha is approximately 400 milligrams per 50 pounds of body weight daily. But again, these are complementary ideas from one particular source, and your vet is absolutely the primary guide for your dog's specific healthcare plan.
Definitely. Well, we've just navigated the complexities of canine hypothyroidism, from understanding its varied causes and recognizing those often subtle symptoms, to exploring the precise diagnostic challenges and, importantly, the lifelong commitment of treatment. The key message, I think, is clear. Vigilance, getting that early and accurate diagnosis, and then consistent treatment are paramount for ensuring your dog's well-being. This condition, while it sounds serious, is highly manageable, allowing your furry friend to continue bringing joy to your life for many years to come. Now, for you, our listener, here's a thought to ponder as we wrap up. What small, seemingly insignificant change in your own pet's behavior or physical appearance might actually be a signal you shouldn't ignore? Maybe it's time to encourage you to deep dive into their health with your trusted veterinarian.